Hi everybody, today we'll talk about egg freezing. Now what is egg freezing? Now who has to freeze their eggs? Why do we freeze our eggs and when is the right time to freeze our eggs? These are the most commonly asked questions among all the youngsters now. So egg freezing is a very simple technique wherein you are freezing your eggs for your future pregnancies. Now that could be for social reasons, like you want to delay the marriage, delay your pregnancy, you are concentrated on a career, you are going abroad for some reason, or another thing is in case you have any kind of cancer related and you have to go for a surgery. Before that you can come and freeze your eggs. Now second question, when is the right time to do it? For every social freezing, I would say younger the better, that is anywhere between 25 to 35, that is late 20s and your early 30s. Why do we say that the earlier the better? Because as you're born as a child, you have a fixed number of eggs that is there in your body and it will keep depleting every time you ovulate or every month. So when you do that, eventually the number and the quality both keeps coming down. So we do your AMH levels, that's a blood test, and antral follicle count, which is an ultrasound, to determine what is your ideal number that you have, and based on that we plan the stimulation. Now is it painful? No, it is not painful. It's a very small procedure. It takes about 10 days roughly, wherein from the day 2 of your periods we give you injections, a single small self-inflicted injection which is like an insulin dose that you have to give to your tummy, and every day you have to do that for about 8 to 10 days depending on how many number you have. Alternately we'll be doing an ultrasound and a very mild sedation under anesthesia. We will do a retrieval of your eggs and then freeze them. So this is the technique which is being used to retrieve your eggs. How do we freeze it? Now once it is removed, we use separate techniques wherein your eggs are frozen, but the number and quality is something that we will not be able to tell you at the moment. But in case we get less number, then we may have to go for a second retrieval so that we get enough number for the future. Why do we do it? Because nowadays due to lot of problems, as in environmental toxins, could be genetic related or could be because of the lifestyle that you have, smoking, marijuana, a lot of other like foods used in plastic containers. These are all the toxins that is there in our body, plus the stress that you go through, whether it is office related or your college related, studies related, whatever stress that you're in. If your sleep is deprived, all these are the reasons where your normal level of number of eggs or the egg reserve keep going down. So we have seen at the age of 25 your AMH is very low and not much can be done. No treatment is there which can improve the number of eggs as such, which is scientifically proved. So that is why we say yes, please consider egg freezing for your future pregnancies so that you can relax and continue with all your commitments that you have. Lastly, is there any side effects? Definitely no. It's a very small hormonal injection that we give, which is there present in your body, and they're genetically modified so that they absolutely have no side effect in your body and they are washed out in the same day. So that is the reason we give every dose, single dose every day we give at the same time. Thank you.